Hello everyone, my name is Manish Kumar Sa. I'm a dental student studying at BP Cases Dharan, Nepal. Here is our the first lecture on local anesthesia, where we deals about the definition, the theories for mechanism of action, and the classification of local anesthetic agents. This is the most important topic in case of oral surgery as well as in the periodontics. Also, it is helpful in the general surgery department to correlate with that. Moving up to the definition of the local anesthesia, it is by the term, it is also clear that local means the specific part of the body and anesthesia means the loss of sensation, which uh, combinedly we can say that it is the transient reversible loss of sensation in a circumscribed or limited, which is also known as local area of the body, caused by either depression of the excitation, in the nerve endings, or an inhibition of conduction in the process in the peripheral nerves without loss of consciousness. Without loss of consciousness, we can see in this picture that the patient is lying on the bed, and the ambu bag is giving the oxygen supply to the patient, so that and the patient don't go to the coma. In case of general anesthesia, we can say that the patient is in the loss of consciousness state, where the patient have no conscious related to the body parts and the procedure. But in case of local anesthesia, this is in contrary, the local anesthesia don't do the loss of consciousness of the patient. It is very much important that it should not cause the loss of consciousness of the patient. Okay. Moving further to the theories of mechanism of action of local anesthesia, the first theory is acetylcholine theory, in which acetylcholine is supposed to be involved in the nerve conduction. Okay, but we know that nerve conduction is a process in which sodium ion is involved in this process. Okay, so this theory is totally discarded, as this not as the justification of this theory is lacking. Now then the calcium displacement theory occurs, which states that the depolarization simply means the uh, influx of sodium ion into the exoplasm, which is now we know that which the calcium ion which is present in the sodium channel, that controls the permeability to the sodium. Okay, the calcium ion which is present near the exo near in the exoplasm controls the permeability to sodium. If this calcium ion is displaced, then the depolarization is prevented. Okay, but this theory also does not support the mechanism of action of local anesthetic agents. Now the next theory is the surface charge repulsion theory, or surface charge repulsion. In this theory, we know the La when when La is in the tissue spaces, it gets dissociated into the ionized and unionized ion. The ionized form is mainly positive. The ionized form of La is positive. Positive. Okay. The ionized form of La is positive, which binds to the nerve membrane the of the neuron and increases the surface potential to more positive. Okay, leading to increased threshold potential and hence decreased conduction. Okay, next the membrane expansion theory. This theory is also okay. Surface repulsion theory is also discarded, as this process have not so much scientific proof yet. Okay, now moving on to the membrane expansion theory, it states that La diffuses to hydrophobic regions uh, and expands the membrane, which prevents sodium permeability by uh, closing the sodium voltage gated sodium channel. Okay, this theory holds true for some local anesthetic agents, which we'll discuss later. Now, the most accepted theory is specific receptor theory, which we'll discuss further on. Okay, the most accepted theory is specific receptor theory, in which most we can conclude that most La are insoluble in water, but we have to give we have to inject La as soluble so that it diffuses freely into the exoplasm to cause anesthetic action. So manufacturer use hydrochloride solution or hydrochloride salts, prepare the hydrochloride salts of the La to make La soluble. Okay, now when La is injected into tissues, it gets dissociated into ionized and unionized form bases. Okay, moving further, the ionized form binds to the sodium channel and occludes it and prevents the influx of sodium, which also decreases the efflux of potassium in further propagation. Therefore, there is the depression of rate of depolarization which occurs simultaneously. Okay, then there is failure to achieve threshold potency in a segment of a neuron. Okay, or the channels associated with the nerve fibers. Okay, therefore there is a lack of development of propagated AP, and therefore there is conduction blockade. There is conduction blockade, so that uh, the sodium influx is interrupted. Okay, now the unionized form, which was present in the tissue spaces, diffuses to the exoplasm. Okay, and becomes protonated ionized form, which is the most stable form of the La. Okay, and this protonated ionized form is the main agent which inhibits the nerve transmission. When the unionized form diffuses to the exoplasm and becomes protonated ionized form, this becomes bigger. Okay, and its passage back out of the cell, and hence it is known as ion trapping. Simply, what is ion trapping? Then we can say that the unionized form of local anesthesia, when diffuses to the exoplasm, becomes protonated ionized form, and its passage back out of cell due to its increased large size. Okay, therefore it does not pass it does not go outside and becomes trapped inside the exoplasm, and this trapped ionized form of La gain access to internal exoplasmic receptors to internal exoplasmic receptors on sodium channel. Okay, and interrupt the nerve conduction. Okay, I have to clear one thing, that the ionized form, which is in the tissue spaces, gets binds and occludes to the receptor site of sodium channel, which is on the outer surface of the sodium channel. Okay, but the unionized form, okay, diffuses to exoplasm and becomes protonated. Okay, and gain access to receptor on sodium channel, which is internal to the exoplasm, okay, which is internal in respect to the exoplasm, okay, and that interrupt the nerve conduction. The difference is that unionized form enters into the exoplasm, but the ionized form remains at the uh, outside, and from there it blocks the nerve conduction, okay. Moving further, here we have the figure in which we can say that this sodium channel, this is a sodium channel which has two sides. One is the outer surface and one is the inner surface, okay. In the outer surface, the ionized form of the La binds here, okay, binds here. This is the receptor, this is the receptor on the outside of the membrane, okay, on the outside of the membrane, which gets incorporated and blocks the sodium channel, and therefore there is the conduction blockade, okay, or sodium influx is interrupted. Now from the inner surface there is also a receptor here and here, okay, and from here the receptor, okay, the unionized form which gets protonated and ionized, they come here and bind to these receptors, okay, and the conduction blockade is occurred. This closes the channel, okay. Moving further, now here is our the classification of La. The first is on the basis of occurrence, okay. The natural type is cocaine, which we can extract from the plants, or okay, different plants or herbs, shrubs like that, okay. Then another comes the synthetic compounds on the basis of source. The synthetic compounds may be nitrogenous, non-nitrogenous, and the drugs with local anesthetic action, okay. In nitrogenous, there is procaine, chloroprocaine, benzocaine, okay, lidocaine, and centbutridine, okay. In non-nitrogenous, there is benzyl alcohol and propanediol, okay. But the drugs which have the local anesthetic action are the clove oil and the phenol, okay. Moving further to the classification, the second basis is on the basis of chemical structure, okay, on the basis of chemical structure, in which the ester is first and amides is second and vinolene is third, okay. Esters of benzoic acid, then cocaine is the answer, benzocaine is the answer, butacane is the answer, and lastly the tetracane. These all are the benzoic acid derivative of esters, okay. And the derivative of PABA, that is para-amino benzoic acid, are the procaine, chloroprocaine, and the propoxycane, okay. Amides. Next, move on to the amides. We can simply memorize it by the mnemonics ABDE LMPR, okay. Also, the amides have two I's in their name. This is the shortcut form from which we can learn the names of amides. Okay, we can see here artican. There is one I, another I. The pupilla again. Here is one I, there is another I. Here is one I, there is another I, and so on. Okay, the artican, the bupivacaine, the lidocaine. The most used one is lidocaine, in which in our practice the prilocaine, etc. Most LAs are, the most amide LAs are injectable dental LA, okay, and amides are heat stable and safe as compared to esters, okay. Esters are not heat stable and it is relatively not safe as it cause the hypersensitivity reaction to the patient, okay. And another is the quinoline, which is centbutridine, okay. Then moving further, This is the most accepted classification of LA according to the biological side and the mechanism of action. Okay, in which in the table we can see that class A. Okay, class A is the agents that acts on the receptor site on external surface of the nerve membrane. This is most important point. Okay, please uh, please remember at this point that the agents which acts on the receptor type on the external surface, as we discussed earlier, the LA injected into the tissue spaces, it breaks down into the ionized and unionized form. Okay, as we discussed earlier, the ionized form remains at the outside and binds to the receptor site on the external surface of the membrane, as we discussed earlier. These are the LA which acts on the receptor site on the external surface according to the mode of action. Okay, in which we can see that biotoxins. Okay, in which tetrodotoxin and saxitoxin are the names. Then B, the agents acting at receptor site on the internal surface. Okay, surface of the membrane only. Okay, this is the only part. This class A LAs acts only on the external surface, and the class B LAs acts on only on the internal surface of the nerve membrane. Okay, the receptor site on the internal surface of the nerve membrane. This includes the quaternary ammonium analogs of lidocaine. Okay, lidocaine, the most used LAs is lidocaine. Okay, and the scorpion venom. And now this class C includes the agents which acts with receptor independent mechanism. Independent means they act by physiochemical mechanism, as we discussed in the theories of mode of action of the LA. In that we can say that the membrane expansion theory. Okay, the membrane expansion theory is the physiochemical mechanism in which the LAs bind to the hydrophobic regions of the surface or nerve membrane, and expands the nerve membrane so that the nerve expand and the sodium channel gets occluded. The best example of this class of LA is benzocaine. Okay, as we discussed earlier, okay, here we can see in the membrane expansion theory that L, LA, okay, LA diffuses to hydrophobic regions and expands the membrane. It expands the membrane, which prevents the sodium permeability. Okay, by occluding the sodium channel. Then in the figure we can also see here the benzocaine. Here the benzocaine expands the membrane, and this channel gets occluded. This channel gets occluded so that sodium does not enter the channel into the exoplasmic space. Okay, now moving on to the class D. Here we can say that agents is the combination. The local anesthetic agent is the combination of receptor and receptor independent mechanism. Okay, receptor independent mechanism is what? The membrane expansion theory, and agents acting by receptor is what? It is the acting site on the external surface or the internal surface, mostly external surface. Okay, and this is the most clinically useful local anesthetic. Okay, mostly clinically useful, which contains articaine in major procedures, bupivacaine. Okay, bupivacaine, also the lidocaine, which we mostly use. Here is the analogs of lidocaine, but here is only lidocaine. Okay, and the mepivacaine and the prelocaine. Okay, the most used LAs are articaine and lidocaine, which falls under the class D, which acts by combination of receptor and receptor independent mechanism. Here is also we can see the same process that within the sodium channel. Okay, at the outer surface of the sodium, and at the activation gate the different venom, and at the inactivation gate different scorpion venom acts. Okay, moving further, here is the main figure which we can see. Okay, the tetrodotoxin. Okay, the tetrado tetrodotoxin, sorry, tetrodotoxin and the saxitoxin. Okay, here we can see. Okay, here we can see the tetrodotoxin and saxitoxin are the natural form which is extracted from the plants or the herb stuffs, etc. Okay, all stuffs, etc. It acts on the external surface. Okay, external. This is the external surface. Okay, this is the external surface. Okay, and this is the benzocaine which acts, this is the benzocaine which acts by membrane expansion theory as we discussed earlier, and this is the lidocaine, pirilocaine, and mepivacaine, articaine, bupivacaine. The most anesthetic agent we use nowadays are in the class D, which acts by which acts by acting on the receptor mechanism as well the membrane expansion theory. Okay, the membrane expansion theory, as we can see the physiochemical mechanisms. Okay, okay, here our classification lectures ends, and uh, get tuned to this YouTube channel for further videos. Thank you.